This guide will walk you through the steps of conducting a static postural evaluation with your client. Once the client's evaluation booking has been added to your calendar, you will find it conveniently located on the Today page. It's from the Today page that you'll start all of your client bookings. If this booking is scheduled outside of a window of 20 minutes of the current time, you'll see a checkbox to tick before proceeding. Once checked, click the Start Evaluation button. The first part of the evaluation is the Measure section. Under the General tab, we input the client's details, such as height and weight and possibly their blood pressure and resting heart rate. If the client's birthday has been recorded on their profile page, then their age will automatically be displayed in the first field. Clicking the Next button will record the data that you've just added, and move you onto the next tab, which is Body Composition. On this page we are able to record and track our client's body composition. We're able to input either manual body measurements using skinfold calipers, or by inputting the displayed values on any biometric scales. We can also set a target body fat percentage with our client. Once set, the amount of body fat that the client needs to lose to reach this goal will be auto-calculated and displayed. Clicking the Next button will record your data, and take you to the last page of this part of your client's evaluation. On the Measurements page you can record your client's girth measurements. This is a great way of showing your client's weight loss or body transformation progress over time. By adding a measurement to both the minimum waist and glutes fields, you'll be provided with a waist-to-hip ratio. This ratio is a strong indicator of health risks such as type 2 diabetes or cardiovascular disease. Click the Video Play button on any assessment to see a tutorial video on testing protocol. Finally, click Next to get to the following section of assessing the client, the static postural evaluation. When it comes to adding a front-facing photo of your client, you have two choices. Either selecting a front view photo from your camera roll or taking a photo right here in the app. Best practice shows that it's ideal to take your client's photo with your device's camera and then uploading it to GoX Pro from your camera roll. Once the photo has been uploaded, the evaluation of your client's static posture can begin. Have your client stand 30 to 40 centimeters from the wall with their feet shoulder width apart. You have the choice to rotate the photo in either direction, or remove a photo you don't like. To level the photo off, take the green line and place it in between the junction of the floor and the wall. This will level the photo off, if it's not quite straight. Clicking Next will allow us to center the photo. First place the vertical plumb line evenly between both feet. We then place the horizontal line on top of their head or the scalp. Clicking Next we can now go ahead and annotate our postural image. We can change the color theme if the person is wearing dark clothes, or click rotation mode to make it easier to maneuver the lines. Starting at the earlobes we line up the bottom of both ears to see if the head is straight. Moving on to the acromial processes, we line up both AC joints to see if the shoulders are sitting at the same height. Next we are moving down to the 12th ribs, where we'll need to come in and touch our client to determine if their rib cage is at the same height left to right. We then draw a line directly across at the bottom of the rib cage from left to right. We do the same thing with the ASIS, the anterior superior iliac spine, to see if the hips are at the same height. Moving down to the hands. How many joints can you see on the back of each hand? If they have perfect shoulder posture, then we'll only see thumbs and none of the back of their hands. If part of or all of the back of their hands are visible, note in the boxes the number of joints you see. At the knee, we move the line so that it passes through the center of the patella or kneecap. If the foot is in the correct position, the line should also line up over the second and third toe, which is the center of the foot. At the tibia and fibula, we are looking for bowed legs. This can be indicated by clicking inside the boxes provided. Next up are the left and right ankles. Here we're looking to see if the foot is neutral. If it excessively pronates, rolls inward with a collapsed arch of the foot, or, if it excessively supinates, rolls out, with a high foot arch. We indicate this with the lines and the arrows. If the foot is heavily pronated, we'll use 2 arrows, and indicate less pronation with 1 arrow. If the foot's neutral, we leave the box empty. We line up through the medial and lateral malleolus for the ankle bone to indicate this. Once you've added all your postural observations from the front view, click Next and progress to the side view. Upload your client's side view photo. When taking your client's photo, have your client turn to their left, and place their feet evenly on the side of the line on the floor. Once done, click Next to upload the photo and get started annotating your postural observations from the side view. We start by leveling out the photo. The plumb line will be lined up with the front third of the ankle bone, and should go through the knee, hip, shoulder and earlobe when posture is perfect. The top line will sit at the top of the head or scalp. Continue to start annotating the client's posture by clicking Next. We start with the head and neck posture of the client. Line up the chin with the occipital bone, which is where the skull meets the spine. For the neck posture, we follow the curvature of the thoracic spine, or upper back, through the center of the ear. Ideally, we'd like to see an angle of 90 degrees, if head and neck posture are perfect. Should the head be forward and the angle be less, we have a forward head carriage. If the ear hole is 20 mm forward of the plumb line, the weight of the head doubles. This can lead to neck tension and even tension headaches. We move on to the pelvic posture now. We will be lining up the front and back of the pelvis. So from the PSIS at the back to the ASIS at the front of the pelvis. Here, we're looking for anterior or posterior tilt, and that angle is automatically calculated for us. At the cervical spine, we have the choice of adding icons for loss of curvature, excessive curvature or normal curvature. Moving our eyes down to the thoracic spine, we look for normal thoracic kyphosis, hyperkyphosis, or a loss of thoracic kyphosis. At the lumbar spine, we might see loss of lumbar lordosis, otherwise known as a flat back. You might see normal lordosis, or a hyperlordosis, also known as an excessively arched back. This excessive arching can be shallow, extending up to the thoracic spine, or a short, deep lordosis. These are both often seen with an excessive anterior pelvic tilt, of more than 9 to 10 degrees. Each of these less than perfect posture positions cause certain muscles to become inhibited, and other muscles to become overactivated and stressed. This increases injury potential as well as disc and joint issues. If while assessing static posture from the front view, we noticed that one hand jutted forward of the other, we would indicate that here, in the box provided. This could indicate a shortening of the psoas muscle on the opposite side. Once you have completed the side view, repeat the process of uploading your client's photo for the back view. Start by leveling off the image. Then place the plumb line vertically and evenly between both feet. The horizontal line is placed directly on top of the head or skull. Clicking Next, we can start to annotate the image. First, we look at the shoulder blades. We line up the bottom inferior angle of the 2 scapula to see if the shoulder blades are at the same height, or if there's any elevation of either scapula. At the 12th ribs, again we would need to touch the client. We feel the bottom of the ribs and then line them up in our app to see if one side of the rib cage is higher than the other. We do the same on the back of the knees. We look to see if the lines on the back of the knees are at the same height, or if there is any leg length discrepancy. Next, we are looking for any protrusion or rotation of the inferior angle of the scapula. Is there a complete unsticking of the scapula at the medial or internal border? Do we see a winged scapula? If so, this could indicate a weakness in the serratus anterior muscle, which is often associated with upper trapezius tightness and neck tension. A downward rotation of the scapula can be seen here. This indicates tightness in levator scapula and upper trapezius with an associated weakness in the serratus anterior muscle and lower trapezius. Next, we are looking at the shape of the spine. Simply choose the spinal shape that best matches your client's spine by clicking in the box provided. If the spine is straight, then we just select straight. At the feet we're looking for any rear foot pronation, rolling in of the heel, or supination, rolling out of the heel. If we see excessive pronation at the alignment of the back of the heel, we use arrows facing in. If we see excessive supination, we use the arrows facing out. Both of these unsafe rear foot positions increase the risk of injury due to poor joint alignment and muscle imbalances. In this guide, you learned how to start your client's comprehensive evaluation by inputting their general details and measurements, as well as how to assess their static posture. This assessment process is a fantastic tool to identify your client's strengths and weaknesses, as well as any predispositions to injury. In the next tutorial we'll be looking at a movement screen to assess your client's dynamic postural stability.